Hey everybody, it's Jody Franklin here, and I brought along my colleagues, Lisa Vassell and Janet Flory, to talk about a CME opportunity that is really mind-blowing and very different from things that we've done in the past. So Lisa, can you tell us a little bit about how this particular CME opportunity, what it's all about, and how you've loved it so much more than some of the other options that you've had?
Well, I'm a nurse practitioner and a nurse, 15, 30 years. So, the biggest thing is the difference between when you go to some of the conferences, it's incredibly dry. So it's the disease process, the treatment, which is always medication. And not that those aren't hugely important, but it's the approach of this kind of a CME for those of us that are looking for that one other thing that might help heal, help reverse a condition, not just treat and slow down the trajectory of the disease. It's all of these other things in the toolbox that you so desperately want when you're a nurse practitioner, nurse, PA, physician. So you have, how do you talk to somebody that's having a mental health crisis more than take this med, go to the emergency room, or go to a psych ward, or go to a psychiatrist. There's 7 things that you have in the toolbox that they teach you at with these CEUs. So functional medicine is just a completely different approach that way. And so to get 50 CMEs in a program that you're only doing 7 hours a week, up to 12 hours a week, to me is mind blowing, because hours and hours at a CME conference can be very dry.
Definitely. And so, Janet, you want to tell us what your experience has been with this? And I'll explain about what the program is in just a second.
Well, with the current COVID crisis, as everyone knows, the good old days of going to conferences is pretty much over, because we're not allowed to gather. And I think most CMEs are going to be online. And my experience with the School of Applied Functional Medicine and what I've learned is it has been such a game changer for helping patients heal with very simple interventions that medication often doesn't use. Literally yesterday, a patient was allergic to clonazepam. I couldn't give her lorazepam. I was stuck, but the good news is that the intervention was some guided meditation, some deep breathing. So there's a lot of things in our toolbox that we don't learn through traditional Western medicine. So I just cannot get enough of the knowledge and education. And to get CMEs and get credit for it is just incredible, especially because we're online forever, as far as I can see. Right. Socially
and
distanced.
The affordability of it, right? I mean, yes. So yep. When we go to conferences, you're looking at, depending upon travel, and which, like you said, may change and shift quite for the near future. But your hotel cost and your eating costs and everything else, and you're getting maybe 15 CMEs for 2 days of missing work, missing family, being away, and $600-700 depending upon what you're looking at. It's just the money and the amount that you're the difference of what you're getting. Not that the other education isn't important and necessary. Right. We all need to know safety and drugs and what they're used for, et cetera. It's but we're all, many of us are just looking for something else. We go into medicine so that we can really change people's lives and really help them feel better, feel vibrant, not just get through the day. And so, it's just really frustrating in medicine now. And a lot of us are getting burnt out because we don't have either the time or the resources to help people that are looking for not just a pill for high blood pressure or high cholesterol or diabetes or depression or rheumatoid arthritis. So that's, it's huge. It's huge to have CMEs offered on top of getting that extra toolbox support.
Right. And I think our CME money that our companies give us is going to be very limited and needs to go towards a course as opposed to paying for hotels and meals and things like that. Right. I think they're going to get a lot stricter. And so getting the CMEs through a course like this is great, because you can pace yourself and you get a lot of CMEs. I mean, 50 CMEs for a semester is an incredible amount. Right. As a nurse and a nurse practitioner, sure. PA. DO, MD.
Absolutely. I want to show you guys, just to inspire really quickly, some of the success stories that I've had in my own practice. And I know Lisa and Janet have had mind-blowing success stories, but I just want to show you the possibilities. This is a man I worked with who had psoriasis. You can see he had actually psoriatic arthritis. And you can see the before here, and then the just a few months later after on the bottom right. He's a woodworker, so his hands are a little stained here, but he's 100% pain-free now from a guy who was on prednisone constantly. He's off all his medications, his painkillers, and he feels great. And this is the healing that can take place with it. The other thing that this is him right here. You can see the after picture a little better here. You can see some of the other people that I've worked with who have had fibromyalgia, extreme fatigue, all kinds of debilitating diseases. And you could take a look at that and see that in just less than a year, they are completely free from all their drugs, off the Vicodin, off the painkillers, etc. So I just wanted to explain that. And then also just to show you, the school is called the School of Applied Functional Medicine. And if you go to the Learn More button on the top left, or you can hit Programs, and then the Core 101 semester, each semester gives you 50 CME credits. And you scroll down here, you can see there are 5 foundational courses where you're going to learn how to look at disease from a whole different perspective. You're going to learn how to get to the root cause, understand how the body systems are connected, and really to get to put your patients into remission. You're going to learn nutrients and supplements. You're going to learn how to look at lab work from a completely different perspective. And even if everything's in reference range, how to glean other information from that to use to help your patients get healthy.
And I think it's important to mention, Jody, that all of it's based on very, very deep science, and that none of it is disregarding everything that we learn in medical school or NP school or PA school. It's all adding on to that and looking at it from, that's all good and true, but look at it this way also, so that you can have, more than one approach, essentially.
Great point, Lisa. And everything's very evidence-based and backed by references as well. And if you look at the deep dive clinical courses, this is where you get to customize your program. Everybody gets Disease Begins in the Gut 101, and then you get to choose 2 more elective courses. So if you want to specialize in hormones, let's say, you could take the adrenal thyroid class, take the hormones demystified. You can learn how to help people with fertility. My practice, we just had a 46-year-old who was infertile and now just had her baby. So you're going to learn all these things that are really exciting and look at disease from a whole different perspective. And then you're going to get all these puzzle piecing cases and coaching calls where these are live case studies and recorded case studies where you get to learn from examples of real life patients. And then you learn what to do and how to get to the root cause of their diseases and put them into remission. You get to participate live, or all the classes are recorded. If you're not able to participate live, you can listen afterwards. You get a treasure chest of information where it's like a database. You can look up things. If you have a patient with diverticulitis, rather than writing a script right away, you can give them options on how to solve it without any prescriptions. So you're going to learn how to do all this. So I just wanted to explain it. We have peer group huddles that meet once or twice a month, where you can actually meet with peers and find out how they're integrating it into their practice. It's led by one of our graduates. And then we have, the certification. It's actually a board certification in functional medicine. And you can see the pricing right down here as well. So it's not very expensive to register, and it's much less expensive than most other functional medicine programs, which can be 2 or 3 times the cost. And actually, we have opportunities to sign up as soon as possible if you're interested. The registration's going on right now and ending very soon. So anyway, any final words from either of you, Janet or Lisa, about the program or about any of the question and answer? I'll have to see if there are any up there, but anything you guys wanted to say?
I mean, the biggest thing that I would say is just that we're in medicine, we're getting burnt out. And COVID has not helped that at all. And so what we can see from the data and the statistics of COVID, morbidity and mortality is that we know chronic disease is the driver for feeding these horrible viruses and other things that are shortening lives. And so, and it's very difficult to continue to do what we're doing, the same education that we're getting. And it's not wrong education. It's just not that there is more. And it's amazing to have that ability to truly reverse diabetes, to truly reverse PCOS and put somebody getting cycling again. They're no longer metabolic syndrome, which they, were basically going to become, to get somebody. Not that medication's wrong. I still prescribe, as does Janet. I know we prescribe all the time. It's not anti-medicine. It's what else can we do to help them while the medicine's helping slow down trajectory or risk. And then can we get off medicine? If we can, great. If we can't, we can lower it. If we can make their body work better while they're on that medicine. That's the key, is giving us more passion, less of that burnout, and giving the patient more empowerment and more accountability. It's fabulous.
It really
is.
I
also think that the COVID crisis is giving patients a lot of incentive to strengthen their immune system. And when they see that they're more at risk to die from COVID with their comorbid conditions, we at my company have a list of how to help patients understand what their risk is. And it's pretty amazing. Obviously, age is one of the biggest things, but all of these reversible chronic diseases, I think patients are more and more motivated, especially because they're working from home, they're not commuting, they're not traveling, they're not going out to eat. To just start focusing on how can I help myself and how can I partner with my provider to help me be as strong as I can in case I do get COVID. And it's very exciting to be able to say to people, I can help you with that. And they're thrilled when they hear that I've taken the time to learn functional medicine, integrative approach. And there's a lot of it's very simple and straightforward, which is the best part about it, is that sharing the information with them, they're like, oh, which is just an aha moment often. And I say, you can do this and I can help you do this. So let's hope none of us get COVID.
Yes. Yeah. Amen. And
Amen.
I know Janet has integrated this into her practice. I mean, she's been doing, being a nurse practitioner for over 25 years now. And now where she's integrated the functional medicine into her practice, her patient ratings have gone through the roof. She's got the highest patient ratings in her company. So that's really exciting. So she's integrating it into a Western practice and she's getting great results for people. And then Lisa has done things very differently. She's done it all kinds of different ways. And now she has her own practice with her collaborative physician, and she's killing it. She's got a great, really busy, full practice. And so there's different ways to do it, but it's benefiting your patients. So I'm really excited. Thank you guys so much for coming on with me. If anyone watching today, I see some of you are watching now, and if you're watching the replay, either way, if you could give us some hearts and share it with any of your friends who are looking for, or colleagues who are looking for CME credits. They have to be in this group to share it, so make sure they join this group. And also comment below if you have any questions about the program. I'm happy to answer. I am a teaching assistant for the school, and I hope to see you guys in the school. The September semester starting very soon. Thanks, guys. Take care.